just this to make it up through. It's only love.
Hey everyone, this video is about the 5 levels of treatment I offer at my TMJ only practice. So if you're a current patient or if you're interested in becoming a patient, then this video is for you. For those of you who don't know me, my name is Priya Mistry and I'm a general dentist with a practice in beautiful Vancouver, where we are dedicated to taking care of patients with TMJ disorders. So let's get right into it. At my practice, once we do an examination on a new patient, we determine the level, the severity of the TMJ condition that person, that individual is experiencing. And we break it up into 5 different categories: levels 1, 2, 3, 4, and 5. With the 5th level being the highest severity, the most severe TMJ condition you can have, if you will, and level 1 sort of being the least. Keep in mind that this is all general information, so please don't try to diagnose yourself. Please wait for a skilled and experienced TMJ dentist to give you that diagnosis. Also bear in mind that the information in this video is about my practice. I am not representing or speaking for any other TMJ practitioner in the world. The first level of treatment, level 1, is considered the least severe. Those who qualify for level 1 typically have a little bit, a very, very little bit of clicking or popping in the jaw joint. Sometimes they have a little bit of jaw pain. Sometimes they have headaches, but this is not something that's consistent. These people do not have a pop or click every single time they open their mouths. Their jaw never locks. They don't have headaches every day or pain every day. It's very inconsistent, and it's usually in times of more stress. These lovely individuals just need a little bit of help getting their jaw joints and jaw muscles back in good working order. For these people, we typically make a TMJ orthotic, just a nighttime one, and we check on them 1 or 2 times afterwards to make sure that everything's working, that they're feeling better, that they're not having these little episodic flare-ups that, again, are not that bad. It's definitely not debilitating for these people. Level 2. For these people, there's a lot more dysfunction in the muscles of the head, neck, and jaw. These people have consistent headaches, facial pain, ear pain, jaw pain, stuffy ears, dizziness, neck pain, shoulder pain, tooth pain, numbness or tingling in the face, and so on and so forth. So definitely a lot of muscular issues going on. And then sometimes these lovely people also have some clicking and popping noises in their jaw joints. For these individuals, we make a daytime and a nighttime orthotic, and we schedule a certain number of follow-ups. We give these people a daytime and a nighttime orthotic. The goal during treatment is to taper off the daytime orthotic, usually within 16 to 18 weeks. And that can vary. Everybody's just a little bit different. So the daytime orthotic is not forever. The nighttime one, typically most people choose to wear it indefinitely. The purpose of the daytime orthotic is to get results faster. It helps the pain go down faster, especially at the beginning of treatment. Once we get the nighttime and daytime orthotics fitted, we see these individuals usually every 2 to 3 weeks for more treatment. We call this treatment informally, we call it therapy. As each individual feels better and better, we then stretch the appointments out. We see them every 3 weeks, every 4, every 5, until we can release them from active treatment. They are feeling better. We have achieved our goals of no more pain at rest, no pain with chewing, no pain with yawning, drastically decreased or eliminated headaches, ear pain, jaw pain, neck pain, etc. A quick side note about the therapy that we do. The therapy that we do is very unique and very effective. It is called craniofacial therapy. At these appointments, we loosen up the muscles in the neck, in the head, in the jaw from outside. Then, of course, we don some gloves and we go inside the mouth and do the same thing. We loosen up a lot of muscles, and we also do some subtle but effective stretching and manipulation of the jaw. This helps the little disc get back in alignment, and that helps to decrease clicking and popping noises over time. All of this soft tissue work is loosening up the muscles and the fascia that surrounds the muscles. Fascia is so important. And if you don't know what that is, look it up now, because fascial connections run all throughout our body. And if one part of the body is tight and constricted, it can affect the rest of the body. So working on the fascia and loosening that up is very important. After the therapy is done, we then right away adjust the orthotics because the orthotics themselves cannot change, but each individual can change throughout treatment. As the muscles relax, as the joints stabilize, we have to adjust the orthotics to keep progressing through treatment. Many people will reach out to me and they will ask, can we just get the orthotics? And the answer is no. My treatment is most effective with the orthotics and the therapy. Let's move on to the next level. Level 3. Level 3 is where there is significantly more joint involvement. And there's, of course, muscle involvement as well. What that means is that these individuals have more significant clicking, popping, and crackling inside the jaw joint. They've usually also experienced incidents of catching or locking, where the jaw actually gets stuck for anywhere from a few seconds to days or weeks. With level 3, what I see is that the disc inside the jaw joint, the disc of cartilage, is usually pretty unstable, and the muscles of the head, neck, and jaw are usually pretty unhappy, leading to a lot of pain. For these people, we make them a daytime and nighttime orthotic, and we see them every couple of weeks to do the craniofacial therapy. As they feel better, we see them every 3 weeks, every 4, every 5, till we can release them from active treatment. Level 4. These individuals are actually locked closed and have been this way for 6 months or less. The jaw locking closed is a very painful condition during which you can barely open more than 1 or 2 finger widths. You're sort of stuck and you can't get to your full range of motion. This condition is formally called disc displacement with reduction. For more information on it, if you're wondering if you have it or not, or if you've experienced it before, check out my video on that. It's linked above and below. For these lovely individuals, it can be hard to even get the orthotics made because they cannot open large enough for us to get impression trays in there or the scanner in there. For these people, we start with a lot of therapy. TENS therapy, transcutaneous electrical nerve stimulation, soft tissue therapy, manipulation, everything we can to increase the range of motion enough so that we can get in there and at least get the orthotics made. Once the orthotics are made, I want to see these patients typically weekly or at least every 2 weeks to do the craniofacial therapy. The craniofacial therapy and orthotic adjustments go a long way in helping these people become unlocked. Once they're feeling better, we see them every 3 weeks, every 4, till we can release them from active treatment. Last but not least, level 5. These wonderful people have unfortunately, very unfortunately, had their jaw locked closed, disc displacement without reduction, for over 6 months. With this condition, the longer you're locked, the harder it is to fix. This is because of the unique anatomical changes that occur with this condition. For more information on this, watch my videos, Jaw Locked Closed, parts 1 and 2, linked above and below. Basically, these people are in treatment for the longest time, and then everything else is the same as level 4. For levels 2 and 3, treatment is approximately 6 to 8 months, give or take a few months. Again, there's no cookie cutter formula for this, and everybody is different. For level 4, treatment is approximately 9 to 11 months, give or take a few months. For level 5, the amount of time in treatment is really anybody's best guess. Again, with this condition, there's some unique anatomical changes, and we are sort of dependent on the body's healing response to bring these patients to a comfortable level. I did have a young lady who found us 2 years after her jaw was locked closed, and she was in treatment with us for 14 months. So yeah, it was a long time, but we got her unlocked and feeling a lot better. A few quick side notes before we wrap this up. 1, the cost of my treatment is dependent on these levels 1 through 5, which again are the severity of the TMJ condition. Number 2, I do make sleep apnea oral appliances. These oral appliances that treat the sleep apnea have a TMJ prescription built into them to help keep the TMJ issue stable once it's already been treated and to treat the sleep apnea as well. Now, keep in mind, if you have sleep apnea and you're looking for an oral appliance, if your jaw locks, if you're having a lot of pain, headaches, jaw pain, whatever, an oral appliance to treat the sleep apnea will not make all of those joint and muscle issues magically go away. The TMJ issue must be treated first. Once it is stable, once there's no more pain, clicking, popping, locking, then an oral appliance can be made to keep the TMJ stable, but to also treat the sleep apnea. So they're two different issues and they need to be treated differently. Keep that in mind. Number 3, I do not discuss my fees online. So please, please do not ask. If you're not local to this area, I'm in Vancouver, Washington, near Portland, Oregon, then please email my office if you're looking to see me for treatment and set up a Zoom meeting with me. I do require a Zoom meeting if you're not local, so I can better evaluate if I can help you. I don't want you to waste your time and money coming here if I feel that I cannot help you. If you are local to this area and you're looking for treatment with me, please call my office to set up a new patient exam with me. So these are our 5 levels of treatment, and they are not set in stone. Keep in mind that every single person is different and there are exceptions to every rule. This is just a basic guideline that I sort of follow in my head to help differentiate between different individuals and the severity of the TMJ condition that they may be experiencing. And again, I'm Dr. Priya Mistry, and I hope you found all this information helpful. If so, please feel free to like, follow, subscribe, do all the things, and check out my other socials as well. They're linked below. For those of you looking for TMD pain relief from the comfort of your own home, check out my free PDF guide called 3 Steps to TMJD Pain Relief. That is on my website. You go to the homepage and scroll all the way down. It's down there. If you have any questions, please sound off below. Please bear in mind that I will not give you an entire consultation or diagnose you via a comment section on YouTube or any other social media platform. And remember, my friends, you can never have TMI about TMJ. Thank you.
Yes, it's so hard loving you.